AML Hub podcasts, brought to you by Scientific Education Support.
Hello and welcome to the AML Hub podcast. Today we'll be hearing from Eleni Gavriilaki from George Papanikolaou General Hospital of Thessaloniki, Greece.
Hi, I'm Eleni Gavriilaki, a hematologist and transplanter at George Papanikolaou Hospital, Thessaloniki, Greece. It's a great pleasure to be with you today and talk to you about new fludarabine conditioning combinations and how they impact the transplant outcomes. Indeed, in the recent EBMT 2022, our group has led a study by the EBMT Acute Leukemia Working Party exploring the outcomes of fludarabine plus treosulfan. This study was based on our previous results with treosulfan and fludarabine in patients with acute leukemia working party. Our center has published real-world data showing very encouraging results for treosulfan, and in 2015 we had shown that treosulfan was better compared to reduced intensity conditioning, and in 2021 we showed that treosulfan might be also better compared to traditionally used myeloablative conditioning, aiming to expand the patient population that is eligible for allogeneic transplant, and most importantly in patients with high-risk HSCT features like secondary AML or unrelated donors. Therefore, we had the idea to design the study in the acute leukemia working party, and the first part of the study was performed in patients transplanted in CR1 or CR2 that was presented at last year's ASH, showing that patients older than 55 years of age had similar results with treosulfan compared to busulfan. And the important thing here is that we compared two conditioning regimens with similar toxicity and intensity. We compared fludarabine plus treosulfan 14 or FT14 to fludarabine plus busulfan 4. Therefore, we compared two regimens of increased intensity but of reduced toxicity. In this year's EBMT, we compared these two regimens, FT14 to BF4. We compared them in patients transplanted with active disease. That is a very difficult patient population, as we all know. And in this patient population, we showed a clear advantage of treosulfan compared to busulfan. And although patients transplanted with treosulfan according to transplant physician's preference were patients that had high-risk features like older age and unrelated donors. Therefore, we believe that there is a special population that might benefit with treosulfan, making more patients eligible for allogeneic stem cell transplantation. In accordance with this study, there were also other studies showing benefits of treosulfan in patients receiving allogeneic hematopoietic cell transplantation. Except for treosulfan, there were also studies in this year's EBMT combining conditioning regimens of fludarabine plus ceotepa plus busulfan, showing encouraging results in patients with acute leukemia. And also there were also similar studies with treosulfan and fludarabine as a conditioning regimen for myelofibrosis or myelodysplastic syndromes. I think that this is a very encouraging era, and although we have learned many things for conditioning regimens, we have to still learn additional things and explore the best conditioning regimen for our individualized patients in the era of personalized medicine. Therefore, further studies, I think, will also give us more insight into the best conditioning regimen for a given patient population. Thank you very much for listening.
Thank you for listening to the AML Hub podcast. We would also like to thank our supporters, Roche, Genentech, AbbVie, Amgen, Novartis, Bristol Myers Squibb, Janssen Oncology, Jazz Pharmaceuticals, and Syndax.
AML Hub podcasts, brought to you by Scientific Education Support.